Demonstrated growth factor CGF mediated accelerated bone healing in root end microsurgery. This multicenter randomized clinical trial was published in the Regenerative Therapy in 2023 by Japanese group. CGF is a plasma concentrate that is taken from the patient's own blood. It shows to contain the same number of growth factor as the platelet-rich plasma. In this study, they hypothesized that this material in root end microsurgery will accelerate the bone healing. 24 patients were recruited. All of them has lesions over the size of 5 millimeters. They use Rod and Mulvin criteria for radiographic evaluation on the PAs, and they use also PIN 3D radiographic evaluation criteria on CBCT. And since they want to see the rate of healing, they use also volume reduction rate, and they has a specific formula as it shows in here to calculate the lesion volume reduction. For the results, in terms of 3D evaluation, they did the CBCT after 6 months, and it shows that for the CGF group, the success rate was 65%, while for the control it was 90%. On the PA, it shows after 12 months that for the CGF group, it was 85%, and for the control it was 100%. However, none of these two were statistically significant. In terms of lesion or volume reduction rate, for the CGF group, the reduction rate was 75%, while 60% for the control. And this finding was statistically significant. So the result shows that using this material will actually accelerate the bone healing. However, I have my take on this study. Number one is that the CBCT follow-up was done only after 6 months, despite bringing the patient after 12 months. So I don't see why not taking another CBCT after 12 months also to compare it to the 6 months CBCT. Number two is that the relatively small sample size, and we know using small sample size sometimes will result in difficult in terms of identifying if there is any difference between these group.